Most men in their 20s, 30s, 40s, 50s don't see a doctor. Urinary leakage, it has a real effect on your quality of life. Being in social situations.
Dating.
Exactly.
Why do you think that is?
The idea that it's still a bit of a taboo is unfortunate. There are solutions out there. The problem is understanding what's real and what's not, what's hype and what's not.
Is there anything that's being hyped up that could be potentially dangerous for men?
There's no question. The biggest one is...
Dr. Gerald Brock is a trained urologist with over 30 years of experience working in men's health. He was the former president of the Canadian Neurological Association and author of over 250 publications.
There's some really good studies. About 3% of men will have some incontinence. 10% of men will have significant leakage.
That is a huge number.
You all want to be healthy. Reading stuff on the internet about all these crazy diets, people who go to the gym, all these supplements that they're taking and are told to drink 15 glasses of water a day and they want to do that before they go to work is really not the right message.
What would you say to those people?
It isn't just about living longer. You need to...
We find it very interesting that the majority of you who watch and listen to this show aren't yet subscribed to our channels across Spotify, Apple, YouTube. It would mean the world to us if you can do us that small kindness. It allows us to continue to bring on amazing guests week after week and continue to provide you with amazing value and content. It's the only thing we'll ever ask of you. If you can hit that follow or subscribe button, it would mean the world to us. Thank you so much and enjoy the episode. Dr. Brock, welcome to Gent's Talk.
Well, thanks very much. It's a pleasure to be here.
Can I call you Jerry?
Please.
We had this conversation, folks, before we started, so I do have that permission. But I just wanted to formally ask for people to know. I'm really excited to have this conversation with you. This is we're going to be talking about a lot of interesting topics around men's health. And this episode obviously doesn't happen without our friends at Depend, so appreciate them for making this warm introduction and having you join me in studio today. And I think, you know, for people, for anyone who's watching this, listening to this, and this is the first time they see you and hear you, who's Dr. Brock?
Well, I'm a urologist, so that's a surgeon who sees patients with any problems with their kidneys, their bladder, their penis. And after I did my urology training, that's after medical school. So you do medical school, then you do 5 years of training. I went to California for 2 years at the University of California, San Francisco, and I did some specialty training in neurourology, which sounds really fancy. But really what it means is that I understood how the nerve supply to the bladder works, how the bladder functions. And in fact, I went there from a grant from the Canadian government to actually study putting the equivalent of a heart pacemaker into the spinal cord to help patients who had problems with nerve supply of their bladder.
Oh, interesting.
Yeah. And then over the last 30 years, I've trained surgeons, trained medical students and urologists, have had a chance to meet patients because, of course, I'm in clinical practice, but also did basic research. So I had an animal model that we used in our lab doing basic research. So I've had a really interesting career in that I've had a chance to meet lots of patients, literally tens of thousands of patients over the last 3 decades, but also have a chance to meet with students and trainees and see people all over the world.
Animal model?
Yeah, so what we do is there's some stuff, you know, the old joke that you can do some stuff, and if you can't do experiments on animals, you can then do them on lawyers. But the truth is that for animals, it gives us an understanding of how the bladder functions, how the penis functions. And so, you know, you had talked about male health, and men's health is really exploding now. And I think that the idea... More than ever. The idea is, of course, that men are terrible with respect to taking care of ourselves. You know, if you break a bone, that's when a guy is going to walk into the doctor's office. But other than that, men typically don't see a physician for 30 or 40 years. From the time they go through puberty and maybe have a couple of questions about, you know, puberty, then most men in their 20s, 30s, 40s, 50s don't see a doctor. And that's different than women. Women see their doctors all the time, childbirth, going through menstrual periods. But guys, generally, if they're healthy, they don't see a physician.
Why do you think that is?
Well, you know, I would think that it's partly cultural. It's partly what we learn from our parents. I think most guys don't see their dads going into the doctor's office.
That's true. My dad still doesn't like to go.
Yeah, I mean, we don't even like going to the dentist, but going to the doctor is something that we don't do. And the problem is that there's lots of really new important advances that men can avail themselves of if they do see a doctor. I think the public media is really helpful in that, because now when you go on the internet, you understand that in fact the idea of getting your cholesterol right and understanding what your blood pressure is doing, in addition to going to the gym and speaking to Johnny, who's maybe going to give you some testosterone product you probably shouldn't get, it's really important that guys see doctors. And so men's health is a really important topic. And I think that if we could really make that message to the people that watch this, then that would be a real plus.
Well, it seems like, we live in a world of trends. And health and wellness is being tapped as a trend right now, post-pandemic. But I believe it's a movement. I think that there's a conscious effort on the part of men in particular to change the way they approach their mental health, their physical health, their emotional health. And there's a conscious effort to try and source proper information, to learn more about how to optimize their sleep, their diet, look after themselves better, live longer. And I think that that's a significant shift in our mindset. And to your point, the internet does help with that, because every time I go on any of my social media platforms, I'm inundated with, hey, if you're in the gym, try this. Or if you're looking at changing your diet to something less carby, try that. And there's so much of that.
And it isn't just about living longer. I think the trend now, which is important, is live better.
Yes.
The idea that it's the quality of your life as much as the longevity that really matters. And so we don't want to simply extend how many years we're living, and the last 10 or 15 years, you really aren't happy, you can't do the things you want to do. The idea would be to be the best you can be for as long as you can be. And I think that's really a message that is important to patients and important to the public in general. And as you say, that there's huge amounts of information out there now. And the problem is understanding what's real and what's not, what's hype and what's not.
Yeah.
And I can tell you, in my world, I see a lot of hype.
Is there anything that's being hyped up that could be potentially dangerous for men when it comes to their health?
There's no question. The biggest one in my world would be the whole testosterone story.
Okay.
Men in the gym, as I mentioned earlier, sometimes have friends that say, hey, I'm taking this, it's a supplement, it's all natural, it'll help you build muscle faster, it'll make you run faster, climb up the stairs, and so on. And for many men, if they're seen by a doctor and they have a testosterone level, if they have appropriate symptoms, then testosterone is a really good solution for that group of men that have been properly evaluated. But a lot of the claims that are being made, and a lot of the products that are out there that claim they are testosterone boosters or will make you feel younger or stronger, it's just hype, it's just snake oil. And I think that's true for a lot of aspects of men's health. And that's one of the real problems, because I think there's a real need for men to understand their health and to get really good advice, but make sure that the information you're getting is really truthful and based on evidence.
The concept of trying to live longer, live healthier, get younger, all of these things is definitely become more and more prevalent. Biohacking has become the new catchphrase. You see everyone talking about it. Every podcaster has a biohacker come on. And as dangerous as some of those things can be, it sometimes feels, or at least to myself, appears as though we're ignoring some of the other things that our body, is happening to our bodies. Now, your specialty is in the bladder. And I want to know more about that, because just from our pre-conversation, I learned so much about how the bladder shapes our daily lives, like the impacts it has on us as guys, and the fact that we don't even really think about it, because it's almost like breathing. We just go to the bathroom and that's it. But there's a lot of men that could use some of the advice that you're about to share. So can we start with just understanding how the male bladder works?
Sure. What you said is so impactful, because if you pull a muscle, all of a sudden you realize how often you use that muscle. So,
Yeah.
You've been playing tennis for the first time maybe in months, and for the next couple of days, every time you lift to write with a pen or something, your arm hurts, and you never used to think of that muscle group. Well, the bladder is exactly like that. When it's working well, we don't think about it.
Yeah.
Your bladder has to store urine. It has to store it for a long enough period that it doesn't interfere with the activities of daily living. But when it's not working properly, you're getting up at night, or you're having to go to the toilet more often, or you're not emptying your bladder completely. Or in the cases of many men, you may have some leakage. And that's really kind of the thrust of what the message I'd like to give today is, that the bladder is an incredible part of our body. So most men will have a bladder that is able to store urine, if they're drinking normal amounts of fluid, for probably 5, 6, 7 hours, meaning you'll have to go to the toilet a few times a day.
Yeah.
Typically, we find the time to do it is not a big deal. In some men, however, that normal control is lost, and what happens is either the bladder becomes so thick and strong because the outlet to the bladder is obstructed, or alternatively, the neurological control of the bladder is not working as it should.
Neurological control.
So let's just take a step back.
Okay.
What normally happens, of course, is most people have 2 kidneys.
Yeah.
The kidneys make urine, goes down the tubes called the ureters, and it fills the bladder with urine. It fills it pretty slowly, a couple of cc's a minute typically if you're drinking a lot of fluid, or maybe less if you're not really drinking a lot of fluid. And so your bladder, which typically has a capacity of somewhere around 400 to 600 cc's, can accommodate 6, 7, 8 hours of being filled before you get that notice that you need to use the washroom. And most people will have an awareness, I probably should empty my bladder. But if you're watching a TV show and you're in the middle of the show, you'll wait for the commercial. You're not in a rush to go. Your bladder can hold that off. And so what happens is your bladder sends a message to your brain, and it says, my bladder is getting full. When you have an opportunity, go to the toilet. What happens next is the bladder continues to fill if you ignore that, and at a certain point you're going to say, I got to get up from the middle of my show. I got to go. Or if you're on the 401, you don't wait for the next exit. You say, I got to stop on the side of the road. You have real urgency to go.
Yeah.
And that's normal, and that's what everybody should have. But there's lots of people out there where that normal control isn't working properly. And the muscles that normally control the bladder, called the sphincter, the same thing as controls your bowels, isn't working properly. And so what can happen is either there's that real strong urge to go and you don't make it to the washroom and you leak a little bit, or alternatively, you have some irritative symptoms, or your bladder is so full that a little bit of a cough or a laugh or a strain of your abdominal muscles, and you'll get some leakage. And that happens to an incredibly high number of men. The studies would tell us that roughly half as many men as women have leakage. And you say, okay, well, that's predominantly a woman's problem. And that's probably because of their anatomy. In a woman, the urinary channel at the end of the bladder is probably a couple of centimeters, 3 or 4 centimeters long. In a man, it's the whole length of the penis, so it's much longer.
Right.
And that gives us the ability for most men to control urinary leaks much better than women. But it still happens in roughly 10% of men will have significant leakage. And as men get older, that number goes up.
Right.
So when we think of that number of people having urinary leakage, it's a huge number.
10% of men, that is a huge number. Like if I were to take that number and just apply it to Canada, that's essentially almost, well, actually, I don't know what the...
2 million?
About
2 million men?
Yeah.
Yeah.
Jeez.
We have a population slightly over 40 million,
Yeah.
roughly half men and women. So it's a huge number that are affected by this.
You don't hear about this very often.
You don't. It's because there's taboo around it. It's socially uncomfortable to talk about urinary leakage. When that happens, of course, you're aware of it.
Yeah.
You're aware that maybe it smells. You're aware that maybe it'll show. People come into my clinic all the time and they choose to wear dark pants because they feel uncomfortable in the summer, because if they have some leakage, people will see. And, all of that to me is a shame, because they also come in and they have Kleenex stuffed in their underwear. And, it's not the solution, to a problem when there are real solutions out there. So I think that the awareness of the problem is important. The idea that if this is something that's affecting your quality of life and that of your partner, that you should ask somebody or look for a solution to it, and that there are really good solutions these days.
What's maybe, for the type of men that are coming into your clinic and speaking to you and are struggling with bladder leaks, what are they typically saying is like, at what point do they finally start to come to you? Because I imagine, it's not an immediate reaction, and they probably live with it for a little bit of time. And it's unfortunate that they feel ashamed or embarrassed, and they shouldn't.
Right.
But, what are you seeing when they come in and talk to you?
Well, that's a great question. There's a spectrum of responses. I think most people, when it happens the first time, are surprised. They wonder what's going on. They think maybe it won't happen again, and they kind of ignore it, hope that it will resolve spontaneously. For most people, men typically have what we call an urge type of incontinence. And so if we think about a classification system, there are a number out there, but the easiest to understand is really that if you're leaking urine, you shouldn't be leaking urine. That's not the usual situation. It could happen because you have, and most men have, an urge type of incontinence. They have that desire to go, they have an urge to empty their bladder, they just don't make it in time. And that could be because there's an infection in their bladder, or the control mechanisms of the bladder muscle and the sphincters aren't working in synchrony the way they should. There's another type of incontinence where your bladder, you don't realize it, but your bladder is really overfilled. And as a result, the pressure builds up and you have a little bit of leakage, and we call that overflow incontinence. And then the third type is actually mixed, where you have a combination of both of those issues at play. For men, it's mostly urge. And if that happens, it probably is worthwhile to understand why. If you have an infection, obviously that's something that should be treated. But if you have a problem where it's just the lack of control of the bladder and the muscles, then, you could see a doctor and look for medication. Or for many people, as opposed to stuffing Kleenex, there are other options out there as well.
The stuffing Kleenex thing, I can't imagine that's very comfortable.
Well, the problem is that Kleenex, of course, is not designed to absorb fluids and stay in contact with your body.
I was thinking about it.
So the thing that happens to men who have leakage is that there could be some like skin reactions. We call it a dermatitis. And that's because your skin in your perineum around your penis and your scrotum is not designed to be wet and moist the whole time. And if that happens, especially if perhaps you're a diabetic and there's a high level of sugar in your urine, you could start getting some fungal infections and some other problems. So there's skin breakdown, fungal infections. We talked a little bit about the fact that other people could be aware of the leakage because of smell. It could be, also uncomfortable for the individual because of all of the moisture and wetness and so on. So, the Kleenex itself absorbs the fluid, but unfortunately, it doesn't wick it away. It's there, and you now have a wet Kleenex in your scrotum. So it's not the ideal way to go.
Is there other things happening to the body that coincide with leakage happening, or can it be an isolated thing?
It absolutely can be an isolated thing, but it also can be associated with men as we get older. The control of our bladder isn't as good. And I mentioned a little bit earlier that as we get older, in most men, our prostates, which sit at the bottom of the bladder, grow. And the prostate's kind of like a donut in a sense, in that the urine has to flow right through the middle of it. And as the prostate grows in size, what happens is that outflow channel gets restricted and your bladder compensates in the same way that your heart compensates. If you have high blood pressure, your heart wall will get thicker and stronger to be able to push blood around your body with high blood pressure. The bladder gets thicker and stronger as the outflow resistance increases. As your prostate grows, your bladder compensates by getting thicker, which is great, except that as it gets thicker, it also becomes less elastic, less compliant, less able to store a lot of urine at a very low pressure. And because of that, in men who are suffering from BPH, benign prostatic hyperplasia, they may also have some urgency and some urge incontinence. Now, that's really not a problem for most men. If it happens episodically, if they can control it. But if it becomes a real issue, then certainly seeing a doctor and talking to him about it and looking at treatment to relieve the outflow obstruction is a reasonable step.
If I'm not mistaken, the bladder can grow in size. as a person ages, right?
Correct. So a baby would have a very small bladder,
Sure.
20, 30 cc's. An adult would have a bladder that's 500 or 600 cc's.
Okay. And is there a particular, like, aside from drinking water, is there maybe like a sugary drink that can sort of trigger like if, let's say you have bladder leakage
Yeah.
and you're only drinking water, maybe that's one thing. But if, let's say, you're prone to drinking really high sugar juices or Cokes or, alcohol or whatever the case may be, does any one of those trigger it further?
Yeah. So I see patients all the time. And, this isn't something that happens just to guys my age. It happens to people across all strata, all age groups. And you're right. What happens in a lot of people, they'll come in and say, hey, doc, I've been well, but over the last, 6 months or so, I find that I have to go to the toilet very often. I have this real urgency. It's a real problem. I feel like I can't make it in time. What do you think's going on? And what we'll find out a lot of times, it's habits. It's exactly that. They decided they're going to lose some weight, and so they're drinking 10 Diet Cokes a day or Coke Zeros a day. And what happens is if you have a huge amount of fluid, especially if it's caffeinated, it causes your kidneys to make a lot of urine very quickly. And the way that the bladder gets filled with urine is through the tubes called ureters that connect the kidneys to the bladder. And if you're having a really large flow of urine very quickly, it actually sends the urine into the bladder so quickly that it could locally stretch the bladder. And the bladder interprets that as being very full. And so even though your bladder's not full, your brain is sensing that it is because the bladder wall is being stretched from that urine coming out like a water pistol, squirting inside of it. And so certain foods will do that. Certain habits will do that.
What kind of foods?
Well, typically it's a lot of vegetables, sort of like tomatoes and, obviously like lettuce, which is basically all water anyway. So if you have some of those,
Okay.
So some of the, people that are, and you mentioned earlier, the idea that we all want to be healthier.
Yeah.
And so you're reading stuff on the internet about all these crazy diets and different approaches, and people who go to the gym and will get, all these supplements that they're taking and are told to drink, 15 glasses of water a day, and they want to do that before they go to work. Well, if you do that, then you're going to have to go to the washroom very often because your bladder's going to get filled really quickly. And if it gets filled really quickly, you may have some leakage as well if there's some real urgency there.
I've always wondered, what's the appropriate color when you've had enough water?
Yeah. So you're right. The urine does reflect how much of the different elements it's excreting. And as you're dehydrated, it becomes a darker and a darker yellow. The urine should never be red. If you see blood in the urine, that's a sign that there's something wrong, especially if you're a smoker. Then you need to look at that to make sure there's not blood in the urine. But the urine can become very dark if you're dehydrated. And of course, as you're drinking more fluids, it'll become just like water because it basically is so dilute. And so there's a range of normal values of specific gravity of your urine, which is the concentration, and that'll depend on your hydration status.
Should you be aiming to have it as clear as possible?
Well, it's an interesting question because, if you really want to have urine that looks like water, that means you're really well hydrated and you're really having a lot of fluid, but that'll mandate that you're going to have some water, that you're going to have to go to the toilet more often. And so men, as they get older, become really aware of that because typically they will get up once or twice a night. And for men in their 50s, 60s, 70s, that's probably pretty much the Canadian average. So that's not a warning sign of anything. But those men have learned that if they then have lots to drink, especially if it's caffeinated or alcoholic after dinner, they're not going to sleep well at night. So for most men, they won't do that. They'll cut back. But the color itself should be anything from clear like water to slightly yellow. If it's really dark, you're probably dehydrated.
I want to go back to the age component of this because you made a point to say that it happens to ages across all categories. What's the youngest that bladder leaks can show up in a young man?
There's some really good studies that show that even in the men who are aged in their 30s or even younger, it's about 3% of men will have some incontinence.
So it's more common than people might think.
3% is a big number.
Yeah.
We hear about, the huge problem with diabetes in our society. It's about 7%. So when we're talking about guys in their 20s and 30s and 3% have some leakage, that's a really big number. When we're talking about men over age 65, some studies say that it's 25% of men will have some leakage after age 65. Now, if it's happening and it's a lot, then I think you need to figure out why. On the other hand, if it happens when, you're playing golf and, you're very active and you don't want to stop in the middle of 9 holes to interrupt the rest of your foursome, then, that's really less of an issue.
Yeah.
But I think that you need to use common sense and really figure out what's going on, why it's happening.
Well, it makes me think about what you said earlier, too, about how some men won't go to a doctor for decades, and if it happens to a young man at 20, 30 and they don't go to a doctor for a long time, that's a long time that they're living with a bladder leak and not doing anything about it.
Right.
When you said golf, it made me think about strain in particular. If you exercise regularly but you're under heavy pressure, let's say you lift heavy weights or you're running a marathon or whatever the case may be, like I just ran a 10-kilometer obstacle course race, and in the middle of the race I found the strain for whatever, like I was tense everywhere, and then when I finally relaxed I immediately had to go to the bathroom.
Right.
I'm wondering when guys are consistently in a gym or lifting heavy, whether that plays a role in how often they have to go to the bathroom or the potential to cause bladder leaks.
Probably not very often.
Okay.
I think the level of hydration probably would be more of a factor in terms of that need to go to the washroom. So if you're doing your 10K and you've hydrated before, and obviously you're expelling some fluids as you're doing your 10K, but maybe you pre-hydrated a lot, it's certainly possible that your bladder is quite full when you're going through the race. And then I'm sure everybody has had the experience where you realize your brain really does control your bladder, because you're fine in the car and you've driven 2 hours on the 401 and you've been okay, but soon as you turn the corner into your house, all of a sudden you have to go to the washroom right away. And so your brain is now stopping the bladder previously from needing to contract, is now saying, okay, you have an opportunity to empty your bladder, you really need to go. And so it's on a subconscious level that control has happened. But for most of us, we're able to put the key in the door. We have the real urge. We literally run to the toilet and we empty and go, But for a large percentage of people, they don't make it. And they leak, and they leak more commonly. And the level of bladder fullness becomes progressively more and more of an issue for a large percentage of the population. So that's where I think some treatment is necessary.
This episode of Gent's Talk is brought to you by our partners at Depend. Gents, if you experience bladder drips or leaks, you're not alone, and it's more common than you think. Depend's lineup of products provide protection from drips and leaks and are specifically designed to fit men's bodies and lifestyles. From shields, which are shaped like a cup for close-to-body fit without any bulk to tackle those annoying light drips and leaks, to guards, which provide maximum protection for larger leaks or surges to keep you dry and protected at all times. Plus, you can easily wear Depend shields or guards inside your favorite briefs or boxer briefs. They're designed for extra comfort, to stay put, and to remain unnoticeable. No one will even know you're wearing one. Try a free sample at depend.com. Is there something better than tissues? I mean, there's going to be, obviously we want to encourage more men to go see doctors. I think it's an
when it's
absolute
appropriate.
necessity. Yeah.
Yeah, when it's
there,
appropriate.
an alternative for the guys who are still hesitant? Because we know there's going to be a segment of guys out there who are going to be like, no, I'm good. I'm okay.
Yeah, there are. Depend makes the guard and the shield.
Yep.
So shield would be if you have some leakage on occasion. If you have heavier leakage, you could use the guard. And, I think the fact that it's designed specifically is a real plus. The fact that it wicks away the moisture means you're less likely to have skin irritation. So there's huge advantages to having products that are specifically designed for a problem. The other thing that I see is a lot of guys who have had some medical condition or surgical condition, like their prostate. And I can tell you that in the vast majority of guys who have prostate cancer surgery, obviously very topical now with Joe Biden just being diagnosed, Of course, he's not going to have surgery because his prostate cancer was found at a much later stage. But for many men, they have prostate cancer surgery, or they have radiation, or they have other treatments. And many of these men will experience significant leakage afterwards. And, in that patient population, really important they use the right products. Certainly there's medication we can use for them, but the truth is after surgery for prostate cancer, most men won't have a real benefit from the medication. There's surgical procedures we can do, and I've done literally thousands of those over the years, but the truth is that for most men after prostate cancer surgery or treatment, they don't need to have surgery. They have the occasional leakage like we were talking about, and if they had the right products, that would help them.
It's like a temporary solution for them during that process.
Yeah. Typically, it's not so temporary, unfortunately.
Okay.
Many of those men won't recover their continence completely. They'll have lifelong ongoing leakage after their prostate cancer has been treated.
There's a permanent solution in place.
Yes.
I see. Okay.
Yeah. And some other men use something called a Cunningham clamp, which maybe is a little too graphic for the audience, but what happens is it's almost like a clothespin or a clothes peg that you put on your penis to squeeze it to prevent leakage. And rather than doing that, having a properly designed device that'll wick away the urine is a much better solution. The other group of patients I see very often are men across all age strata who have diabetes. And that group also is more likely to have some urinary leakage. And then, of course, there's another group of men, really a large group, who have some sort of neurological problem, whether it's multiple sclerosis or Parkinson's or something else. And that group of men also have occasional leakage. So in that group, I think the idea,
that spectrum.
Yeah, I think that the idea of having products that are designed specifically for that purpose is a real plus for a lot of men who are suffering from it, and it really does affect quality of life. So urinary leakage, I know that, it's easy to sort of trivialize it, but if you're affected, the people that are watching this understand it has a real effect on your quality of life and on your partner and in how interested you are in being intimate with your partner and, being in social situations.
Dating.
Yeah, exactly.
Work,
exactly. For all of those reasons, it's a shame because there are solutions out there.
What about stress? You mentioned neurological effects. Stress, traumatic events, the death of a loved one, anything that happens that really puts a strain on a person neurologically or even emotionally. Yeah. How does that play out when it comes to bladder leaks? Can it is there a correlation between the two, or is it possible that if you already have a bladder leak, even if it's minor, it can be heightened, if you will?
Yeah. I'm not convinced that has a major effect, except that some of those really traumatic life events probably would cause some, mental issues in terms of depression. And as a result, people become really quite physiologically impacted when they have severe depression. So, they don't take care of themselves. They don't care about their appearance. They may, sort of avoid even normal hygiene and toileting. And so in that circumstance, then I can see that would have an effect. But being in a stressful situation, I think we've all experienced that, you start becoming hyper aware of your heartbeat. Am I sweating? Am I breathing funny? What am I doing with my hands? And your bladder and voiding habits are part of that as well. You become aware, you say, oh my God, I feel like I need to go to the toilet. My bladder feels full even when it isn't. And so that sort of anxiety or other stress can have an effect. But generally, in terms of incontinence, I don't think that's a major player.
What about people who work jobs that may not necessarily afford them the option to go to the bathroom when they need to?
Yeah.
I can remember working a retail job where I wasn't allowed to go to the bathroom until I had my formal lunch break, and that could be 6-7 hours before that happened, and I'd have to go in between.
Yeah.
Obviously some employers today, if you got to go to the bathroom, let your people go to the bathroom, but for whatever reason, your job doesn't allow for it.
So, Samir, if you have the urge, just stop now and I'll just keep talking. Okay? But so you're right, absolutely. And we know there are people that work outdoors, especially in the winter, as an example. There's some communities in northern Canada where, they're outdoors and it's so cold that it's a problem. And there's something called an Inuit bladder, which, it's just sort of how we term it, but it's basically people train their bladder. And that if you can avoid emptying your bladder for prolonged periods of time over an extended duration, your bladder will continue to grow in size and get bigger and bigger and bigger, so that some patients may have a bladder that's a liter or a liter and a half. That also happens to some people who have prostate obstruction or urethral strictures. The channel that goes through the penis is called the urethra, the normal urinary channel. And in some men who have had an infection or trauma, they can have a scar in the urinary channel. And that would prevent the bladder from emptying adequately. And as a result, the bladder compensates by, again, getting bigger and bigger and bigger. And the problem with that is that as the bladder does get distended, it isn't as good physiologically. It isn't as able to completely empty itself. And as a result, you have residual urine. It puts you at a risk for infection, but also a risk for leakage. And as your bladder gets more and more distended, then if you cough or laugh or strain or get some abdominal pressure, there may be some leakage in that situation as well. But those situations represent the real minority of cases. And I think for the vast majority of men who are watching this, if they're in their 30s or 40s or 50s and they have the occasional leakage, there probably isn't an underlying worrisome medical condition, especially if it happens episodically or if they're recognizing it happens in certain situations. I'm out golfing, or, my bladder's really full, I couldn't make it to the toilet and I had real urge. Then those situations aren't nearly as worrisome. On the other hand, if this is something that's happening on a regular basis and you don't understand why it is happening, then probably asking a physician for some advice makes sense.
Guys are literal. What's a regular basis? And I say that because there could be scenarios where someone's listening and watching this and goes, well, you know what, it happened to me last month and it's happened again to me, like a few days ago, and it might happen again in a couple of weeks. Is that regular? Is that the point where I should go and speak to a doctor?
So I have a little bit of a bias. I would say that, being in a urologist, I would say that if the person is concerned about their urinary leakage, then it's worthwhile to talk to a physician.
Sure.
And everybody's going to have a different threshold where that level of worry will happen to them. But if it's something that's truly a one-off, it happened 6 months ago and it happened now, I'm not worried about that individual. If it happened a month ago and it happens now and your bladder was full I'm not worried about that person. But if it's unexplained and it's regular, meaning it happens several times a week, then certainly I think this is something you need to look with the doctor at the underlying cause and see if it can be a solution. Certainly if there's any pain associated with urinary leakage, that's something to seek medical care for, because that would mean that you may have an infection, and that should be treated with antibiotics typically. Right. And in men, we typically don't get bladder infections. Women do, again, because of that short urinary channel. But for men, a bladder infection is something that's pretty unusual.
Why?
Well, again, because of the bacteria having a long way to go up to get into the bladder, that makes it much less common for men to get infections. Men can have prostate infections that can give very similar symptoms. There would be a lot of pain, typically pain with ejaculation. And if a man has kidney stones, sometimes that can give symptoms that are exactly the same as a bladder infection. A lot of burning, urgency, urinary loss, and being uncomfortable. But in the absence of pain, in the absence of it happening on a regular basis, meaning a couple of times a week as an example, there's probably really no concerning features that would mandate that person has to see a doctor.
Right. I want to go back a second. You talked about being able to train your bladder.
Yeah.
I wonder on the flip side of that if trying to hold it in can become the reason or a cause for a bladder leak.
You'd have to have everybody can hold their bladder for a while. And at a certain point, you really reach a point where you're an extremist and you have to empty your bladder regardless of where you are or what you're doing. But training your bladder is not something that is commonly done. And we do it in patients who we put a new bladder into, especially if they haven't used their bladder, like they have kidney failure, we put a new kidney in as a transplant. A lot of those people will have very, very small bladders, maybe 50 cc's, and we'll do a bladder cycling or bladder training where over the course of several months, their bladder will expand and become normal. So for most people, if they find they have urgency, and specifically if they have urge-related incontinence, the idea that you should train your bladder by squeezing and holding it and trying to expand your bladder is not a good strategy, because that would be contrary to exactly what you want. What you want to understand is, in that scenario, why do I have urgency? What's going on, and why I have urge incontinence, rather than trying to just personally expand your bladder.
I want to try and familiarize the guys who listen and watch this podcast with what they can expect if they're going through, a scenario where they've got a bladder leak and they come to you, for example.
Yeah.
And say, hey, doc, I'm struggling. Here's what's happening.
Right.
What's the first step there? What happens? Can you walk us through what that process looks like?
Yeah. So it would really depend on what their underlying medical condition is. So as an example, something very simple would be that patient who's had prostate cancer surgery. He comes in and he's having some leakage. Likely what's happened at the time of the surgery, the muscles that normally control the bladder, the sphincters, have been injured when the prostate was removed, because there's two sphincters in a man, one at the top of the prostate, one at the bottom of the prostate, and both of them work together. And when the prostate's removed, very often one of the sphincters can be significantly damaged, and the other sphincter usually is taken with the prostate. So instead of having two sphincters, you have one remaining, and it might have been injured neurologically at the time of the surgery. So that's a simple scenario. We determine how much residual function that sphincter has, if there's been any injury neurologically to the bladder, and then we provide them with either medical therapy or surgical therapy. The medical therapy typically isn't very effective in that patient group. The surgical therapy is. And for many men, once we uncover that, the amount of leakage they have is not severe, can get slightly better over time, although typically never goes away. And in that group of men, we'll talk about various solutions, including what we talked about earlier, using something like a Depend. Alternatively, in younger men who have no underlying reason why they should be leaking, a really important discussion about what their dietary habits are, what their social habits are, when is it occurring, what do they experience when they have some leakage, how frequently does it occur, how much leakage do they have, and try and uncover what the underlying cause is. In the absence of pain or blood, then it's much less worrisome to me. But some of those men, especially the younger guys, sometimes urinary symptoms can be one of the earliest warning signs of multiple sclerosis. And I can tell you, over my career, I've picked out a number of young men who come to me, young men in their 20s and 30s, with new onset of significant, meaning a lot of urine very frequently, urinary incontinence. In that scenario, they do need a workup, and we do try and understand why it's happening and provide them with a solution. But those represent the two extremes, one that really is very difficult to make a diagnosis, the other is very easy. The vast majority of people who will be watching this may have an urge type of incontinence that occurs once a week, once a month, maybe more often or less often. And it's usually small amounts of urine, but it's still really troubling. And it still really affects their quality of life. And for that individual, we would make sure that their bladder is functioning normally, that their muscle tone is normal. We talk about fluid intake, dietary habits, social situation, and try and uncover why it happens. And for many of those men, it's just a simple discussion about, maybe having 3 cups of coffee isn't the right thing for you. Or maybe don't go for that double espresso, because really, obviously, when you have that much caffeine, it making urine so quickly, your bladder at this point, your sphincter, really can't control the urgency that you're experiencing.
Is it caffeine that could really trigger?
So what caffeine does is it affects the bladder, but it also affects the blood flow to the kidneys, and as a result, how much urine the kidneys make. So caffeine can be a really significant bad actor in this condition.
Interesting. Yeah. I'm not a caffeine drinker. I don't drink coffee.
Me neither. I don't drink coffee either.
But there's a lot of people that do.
Yeah.
And naturally so. So what would you say to those people? Should they be cutting down? Is there this is a safe amount? So the beauty is that you can do their own trial. And what I tell them to do is, I think this is the problem, Mr. Jones. I think the fact that you're having your Coke Zero or your coffee or your tea, because tea also contains a lot of caffeine. I didn't know that. And once I found that out, I stopped having it because I really didn't want any caffeine.
Okay. And so we'll say, just stop it for 3 or 4 days and tell me what happens. The beauty of the urinary system, as opposed to the bowels or other parts of your body, is you get a very fast response. You'll know within 24, 48 hours if that change in your dietary habit has affected an improvement in your control of urine. because we make urine all the time, and you have to urinate several times a day. So you'll know very quickly the impact of fluid.
I'm thinking about when I fly to places. I could drink either the same or even less sometimes, but I find the frequency in which I have to go to the bathroom when I'm in the air significantly rises.
Yeah.
What is that a cause of?
I truly don't really know the real answer, but I can tell you that I experienced that as well. And
it's so strange.
It's really weird. Part of it, for me at least, is that I never want to be in a situation where I have real bladder pain because I want to empty my bladder. And also, I'm kind of averse to waiting in lines. And the idea of limited access to the toilets for me is a big driver. So just as we've taken off and they released that, the seatbelt signs, and you're allowed to move about the cabin, typically I'll get up right then, even if I've urinated just before I boarded, and I'll urinate again, even though my bladder may not be full. And often, again, depending on how much fluid you take before you get on the plane, because the air is drier and you're going to be dehydrated when you're on the plane. I think a lot of people probably, if they go to a lounge or whatever they do, probably have quite a bit of fluid before as well. And there may be some element of anxiety as well that may play into it. People are nervous flyers, and so...
Yeah, I don't enjoy flying.
You don't?
Could be to it. Yeah, now that I think about it.
Yeah. So all of those factors, the fact you don't have access, the fact that maybe you have more fluid, a little bit of anxiety, I think those all play a role. But, the brain is amazing, and it controls our bladder so precisely. The brain controls a number of bodily functions. It controls your heartbeat. It controls how well your bowels are moving and how much movement in your intestine. That's not something you can voluntarily control. That part of our nervous system is called the autonomic nervous system, and that's what runs our bladder. Now, what we have control over our sphincter. So you can voluntarily decide to empty your bladder whenever you want to. But what's happening is all you're doing is you're releasing the sphincter, the muscle that normally closes the channel, and your bladder will then empty because your brain is going to send it through the autonomic nervous system. In the same way that you can empty your bowels, but really, again, it's the sphincter that's being released. You can't get your intestine to be more or less motile. And so the brain has an integration of the non-controlled part of the bladder function and the controlling part of the bladder function, and they have to work in concert to work properly. And very often, as we get older, unfortunately, that delicate balance, that dance that has to happen between the two nervous systems may not be functioning completely normally. And as a result, people will experience those urgency symptoms, incomplete emptying, and so on, that can lead to incontinence.
You mentioned neurological damage. I think that was the right terminology that you used.
Or injury.
Or injury, sorry, thank you. Which I found interesting to say, neurological injury when dealing with, let's say, a bladder leakage. What's the correlation there? Can you explain that to me?
Sure. So the nerves control the bladder, which is a muscle, and it's kind of like a balloon. And it's a balloon with a muscle layer that has to contract in order to empty. It also has to relax to accommodate urine. On the bottom of the bladder, you have these two sphincter muscles which seal the outlet, that seal the urinary channel. And what happens is it's a beautifully orchestrated arrangement where what happens is the first muscle, the first sphincter, has to relax at the bottom of the bladder contracts, and then the other muscle, the sphincter, opens and the urine goes out beautifully. If what happens is there's poor coordination between these various muscle groups, whether it's a nerve problem or a discoordination, is you could have your bladder contracting, but the sphincter is not opening. And as a result, you're not getting the urine out, but your bladder's contracting, and so what happens is it builds up pressure, and then eventually it may open. In someone who has something like Parkinson's, their nerves don't control their muscles very well. So someone with Parkinson's, you'll see them shaking with their hands, and they have a hard time getting out of a chair, moving very slowly, and they're almost frozen when they start moving, and then they pick up and they start walking more quickly. So the same thing happens to their sphincter muscle. Their bladder contracts, and they're trying to open their sphincter, but it opens very slowly, in a delayed fashion. As a result, high pressure builds up in the bladder, and then the bladder muscle poops out before it's emptied completely. And so what happens is you don't empty your bladder completely and your sphincter closes again. And now instead of emptying the 500 cc's of urine in your bladder, you end up with 300 cc's of residual urine. And so that person's going to have to urinate again. And also what happens is if the sphincter closes very slowly, then some of that bladder pressure may cause urine to continue leaking, and that person may leak and leak and leak and leak.
And then that's how they're dealing with the like the unwanted leakage.
Right. And so some guys also will describe that they go to the washroom and they're great, everything works well. They walk away from the washroom, and then 5 minutes later they look at their underwear and it's soiled. They've leaked. So why did that happen? What kind of leakage is that? And very often what happens also is there that discoordination between those two sphincters on either side of the prostate, where the sphincter at the bottom closes and then the one in the bladder opens and some urine gets into that area between the two sphincters. The sphincter at the bottom is under voluntary control. So Samir, if I asked you to squeeze the urinary channel closed now, the muscle you're contracting right now is your external sphincter, the one on the bottom. And you control that. You can relax it, you can contract it, but you can't keep it contracted for very long. Maybe for 30 seconds, maybe for a minute. If you practice, maybe for 5 minutes, but you can't keep this one closed continuously unless you've trained it over the course of months and months and months. The one inside, the internal sphincter, the one at the top of the prostate or the bottom of the bladder, that's almost always closed normally. And so that's the one that keeps being incontinent. But what happens is if there's discoordination and you end up with a little bit of urine in between the two sphincters, the one on the bottom is going to open after a couple of minutes. And that's why those men who leave the washroom thinking they've emptied their bladder find their underwear soiled afterwards.
What's interesting is as you were just talking, the way you described it of a guy, let's say, going to the bathroom and then leaving only to find out that he had soiled himself. It really sort of highlighted or gave me the visualization of someone not, like, you don't even know it's happening.
Right. Exactly. Small amounts of urine leaking out may be imperceptible. And I'm sure there's many men who are watching and listening, are told by their partners who does the laundry, hey, what's going on, Johnny? Right. All of a sudden I'm seeing a whole bunch of soiling, and they're maybe unaware of it. And so, that brings home an important message that if that's happening, you're leaking, and it's not so much that you're soiling your underwear. It's the fact that if your underwear is wet, it could cause other issues with skin breakdown and so on.
So what would you say to men listening to this, watching this, or maybe they know someone, a family member, a partner, who is struggling with bladder leakage, and they're resistant to doing anything about it because, to our earlier conversation, there's still stigma around it. There's still like a sense of embarrassment around it. They don't need to be, like, it's a health thing, right, but they still are. Yeah. What would you say to those guys? How would you convince them to go get help? Yeah.
I think we're dealing with incontinence today in 2025 the way we were thinking about problems with erectile function issues back in the late 90s. Almost until it made it onto late night television, no one talked about it. Yeah. And it was a thing that impacted couples and impacted quality of life. There was effective therapy that really was just being developed at that time. And I think that's where we are now with incontinence, that it's important to think about it, talk about it with someone you care about, speak to a physician if it bothers you. There are, as we talked about earlier, some specific products that can help take care of that issue if it's a problem with skin irritation or smell or urinary leakage that bothers you. But I think the key message to the audience would be, don't ignore it. There's no reason to ignore it. And I think that the idea that it's sort of still a bit of a taboo is unfortunate. And I don't think that's true in all cultures, but certainly it's true in Western cultures. And it's something that we should change.
Why is it still
we're so interested in youth and health, at least, the perception of youth and health, that I think that if you have leakage, then that means you're not healthy or you're not youthful, which is really not the right message. And I would much prefer the idea that, if someone is having some urinary leakage, first of all, they recognize it. They say, okay, let me try and understand why it's happening. If they can't figure it out, then speak to someone who can help them, and then go and get the appropriate care that they deserve and they need. Because sometimes it can be more than just, a little bit of a smell or a bit of irritation to your skin as the underlying cause.
What happens if it's left undiagnosed or untreated, rather?
For most people, it's not a big issue, to be honest.
Okay.
For most people, it's not, something that's going to, be something that's terrible. Having said that, you can drive around with low air in your tires, and you're probably going to be fine. The car doesn't handle as well. You're not going to get the same gas mileage. You may not be able to stop quite as quickly. But for most people who don't worry about their air pressure in their tires, not a big deal breaker. And it's the same thing for incontinence from my perspective. For the vast majority of people, you'll have a little bit of skin irritation probably. There may be some smell. You may be soiling your pants. People may notice it. But is it going to change your overall health? No. It'll affect your quality of life. But to me, the issue is it's really easy to fill up your tires with air. And why wouldn't you go and get something done for this as well? The other thing is that there is always a small chance that the underlying cause is something that could be completely corrected and treated. And why would you not want to avail yourself of that information and that potential treatment?
Yeah. Which again goes back to this idea of getting guys to go see their doctors more regularly.
Yeah. Be more self-aware.
Yeah.
Also, be a little more in touch with your body. I think that's an important message too. Yeah. And if your podcast does that, then it's a real service.
Hoping. I mean, that's the whole point of these conversations is to try and get more men to have open dialogue about their mental health, their emotional health, their physical health. Yeah. Because it's necessary. It's 2025.
And they all integrate. Yeah. I think that you're dead on. The idea that if you're feeling well, both mentally, physically, you probably are going to be more productive. You're going to be better with your partner. There's so many positive attributes that come from that. Yeah. And don't ignore your body. Your body's telling you something. So listen to it.
Yeah. Well, what's funny is I've been on a health journey, I'll call it that, for a couple of years now. Post-pandemic, where it was kind of just you kind of just did whatever you did. You ate whatever you ate. But since then, I've been a lot more conscious of what I eat, what I drink, how often I exercise. I try to train every day to varying degrees of intensity, because obviously recovery is important. But as I continue to learn through just the conversations I have with gents like yourself about the different ways the body behaves and misbehave sometimes. Right. There's so many little things that you can do that really don't affect you very much. And it's a simple approach to just correcting your quality of life that will eventually help you live longer and healthier and happier. Yeah. And I wish more guys would take that into consideration, or at least make it more of a priority.
I couldn't agree more. And knowing what I know about the human body, I mean, I've been a physician now for many years, for many decades. I've seen literally tens of thousands of people. The human body continues to amaze me. There are some very bright people who develop software and it's wonderful and it does amazing things for us, but it doesn't fix itself. The human body fixes itself. If we have a problem, very often we recover. If we've strained a muscle, it recovers. Yeah. But at the end of the day, your body tells you something. So when you do injure a part of your body, you're aware of it. Yeah. And you have to respond appropriately. So if I pulled my muscle out playing tennis, I don't go the next day and play golf, because that's just going to exacerbate the problem. So men have to have a sense of understanding. They have to have a sense of recognition. And as an example, the topic today was incontinence, that if you do have some leakage, your body's telling you something. Yeah. Figure out why. Figure out why it's happening. Don't just ignore it. And treat it, manage it, understand it, and I think you'll be better off for it.
Amazing. Dr. Brock, thank you so much for your time.
It's been an absolute pleasure.
This is so insightful. And I really appreciate you making the trip over here to have this conversation. I definitely think more guys need to be aware of the topic of incontinence. And for those that are listening and watching, our friends at Depend did let me know to let all of you know that there's a free sample kit on their website, and that it's also delivered discreetly, which I think really speaks well to their understanding that a lot of guys still might have a sense of, like, I don't really want anyone to know about this.
Sure.
So make sure you check that out if that's something that you need and you want to test it out. And Dr. Brock, if someone wanted to, they listened to your voice just now for the last, 45, 50 minutes, and they're like, you know what, that's a person that I feel comfortable coming to. Are you seeing new patients? Can they find you? How would they do that?
Yeah, it's by referral. So they speak to their family doctor and they send a referral to my office, and I'd be delighted to see any of the people that are watching or listening.
Amazing. Thank you so much. Thank you to our friends at Depend for making this happen. And I hope we can have a part 2 someday.
That would be lovely.
I think there's a lot more here that we can talk about to help some guys out there.
Great.
Yeah. Thank you so much.
My pleasure.
Thank you, everybody.